Hi, my name is Jenny Branson, and I'm a board-certified music therapist living and working throughout Louisville Metro. I'm so excited to be invited by the Kentucky Cancer Program to talk to you a little bit about music therapy and how music therapy can be used to help families that have been impacted by oncology care. So today we'll talk a little bit about what music therapy is, about some things that are not music therapy but that are good, and how music therapy can be used to help families, clients, family members, and care partners throughout the entire care continuum of oncology care. So an important thing to know is that music therapists are musicians who are specially and highly trained to know how to use music to help our clients meet goals. Sometimes those goals are medical goals, sometimes they're emotional behavioral goals, sometimes they're palliative care goals, they might be academic, and they might be relational with the family. So the thing that sets us apart from other types of therapists, whether it's in a rehab setting or in a counseling setting, is that we're musicians. So all of the things that I have in my studio here with me might go to work with me at any time. Music therapy is clinical and it's evidence-based. So there is research behind the work that we do and the interventions that we provide. A really important thing about music therapy is that it's client-centered. So all of the work that we do addresses the preferences, needs, and values of the client and their family. So in addition to the research that backs up the work that we're doing, our own clinical expertise that we bring to the session, we always honor the preferences of the client. It is systematic and it does require a referral. Sometimes, depending on the setting, the referral comes from the client. It might come from your physician, it might come from another therapist on your team, or from the nurse providing your care. Some things that you might have seen that are not music therapy, but that are very good, are visiting artists. So you might have been receiving oncology care in the infusion center or been in a waiting room and seen a musician performing. That is a really important type of programming that we have throughout the country that provides added value for our families, but also just provides a nice distraction and a comfort. So those musicians do serve a purpose and is an important part of the care continuum. You may also have seen listening programs, so maybe you've been in a facility or to an infusion center that provides an iPod or overhead music. Those are lovely adjuncts to the care that you're already providing, but they're not music therapy. So music therapy, just like nursing or physical therapy, does require a therapist. In our case, music therapists are credentialed. We have a minimum of a bachelor's degree in the field. Many of us have a master's degree, and we have a national board certification. Just like a teacher or a nurse or any other type of therapist, we do adhere to continuing education guidelines. And usually that education is specific to the type of work that we're interested in, that we're doing. So if you meet a music therapist working in oncology care, they are skilled in music therapy and especially trained to deal with families and patients facing some of the uncertainties and emotional needs of oncology care. So why would we use music in oncology care? And there are lots of reasons. We use music in a lot of different settings, really for the same reasons. Music is social. It's a social activity. And in a time when many families might feel disconnected from one another or from their communities, having music can be very normalizing, and it can feel much more safe than some of the other things we might do. Music is organizing. It organizes us in time and in space and in relation to one another. So music doesn't exist in a vacuum. Even if we're just listening to music on our iPod, we're still enjoying it in relation to our experiences and to other people. It also provides a way. So it can provide a way for you to connect with other people. It can provide a way to express and process some of the emotions that might be happening as you navigate oncology care. It provides a way for you to connect to your family members in a time when you might feel disconnected. It also can provide opportunities to learn coping strategies, so helping to deal with pain or nausea or anxiety that can accompany treatment or changes in your care plan or changes in your status. So it provides a lot of supports and mechanisms that are important. And music therapists are the people trained to know how to do that. So some of the work happens at the chair side or the bedside or during the session, and some of the work happens in the session so that you can take that along with you to have some strategies and tools to help provide support to yourself and to your family members day by day. So when we're thinking about the fact that music helps us connect and helps organize us and it is part of the evidence-based model of music therapy. It fits in perfectly with our oncology model of care, which is also very client-centered. So when the music therapist comes to meet you and your family and to assess your needs and find out what's the best treatment plan for you, it will all rely on what your needs and values are. And the music that is used in your intervention and in your sessions and throughout your care will be dependent on your preferences and needs. So there's not a prescription for, if a patient is feeling anxious, you play this song. It's never that simple. It depends on the patient's music history, their preferences, and their needs in that moment. So there are lots of things that you might do in a music therapy session, and it will depend on whether it's an individual session where it's just you and the therapist, a family session where it's you, your family member, or care partner and the therapist, or a group session, whether maybe you're part of a support group that meets regularly and you get to know each other, or it might be a drop-in group where it's just a one-time intervention. So there are lots of different things that might happen in any of those. The biggest thing that will happen is that you'll engage with music, and probably at the highest level that you're able or willing to do. So that might be listening. It might be listening to the music therapist as they provide something to you. Most often it's making music. So making live music with acoustic instruments or making music with electronic instruments. And that could be playing along with someone else. It could be improvising and making your own music. It might be making music like you do at home with your own family or friends. And it might also be songwriting. So writing song lyrics or parts of song lyrics can be a really important way to process what's happening and get it out and start to talk about it. So sometimes music therapy provides the launch pad for some deeper work that might happen in a counseling relationship with your music therapist. The music therapist can also provide some tools to help you know how to use music on your own at home. So you might learn how to use music for relaxation, to help with pain management or anxiety, to help improve sleep. You might learn how to use music to help increase your energy levels. So if you're having a lot of fatigue or a lot of nausea, the music can provide a nice distraction, but also provide your brain with the nice boost that it needs to get up and feel like it might pursue some things. Music therapy can also be great to help with mood. So if we have clients or family members experiencing deep anxiety, depression, or fear, it can be another way to help us think about and process what we're experiencing, but also to shift it. Sometimes we need to shift our mood up or down or forward. And so using the music as the vehicle for that can be really great. As humans, we're programmed to move, so it is very possible you will move in your music therapy session with your music therapist. And it might be seated, it might be standing, it might be small, it might be large movements, but movement is an important part of what we do with and to music. Another really important thing you might do with your music therapist is learn how to have another leisure activity. So often we meet clients experiencing oncology care, whether it's short-term or long-term, that no longer have the ability or the energy to pursue their hobbies or their leisure time activities. So engaging in music can be a really great way to have a leisure time activity and to stay connected to your community and to your friends. Even if you've never been a musician before, we can help you learn an instrument or learn some singing skills and just learn how to connect in that way to remain part of your community and also to feel like you can do. It's so easy for us to listen to all the things we can't do when we're experiencing treatment or changes in our status. And so having someone tell you, here's something you can do, and to be able to work on that, to practice and learn and accomplish something can be really empowering to our families. It's important to remember that music therapy is an important tool for all ages and stages. So even if you have tiny family members that they're not experiencing the oncology treatment, but they're experiencing the upheaval with the family, music therapy can be a great way to help little ones be with their parents and just do something very typical. It can be a great way for them to learn. So music therapists are trained to present information that's developmentally appropriate. So it can be a great way to educate your kiddos across all life stages about what might be happening. It's great at the time of diagnosis to help process the new information and think about how we each feel about the situation. music therapy can be really powerful as you're moving through all the stages of treatment, just to cope with the different symptoms and the different side effects that might be happening. And for our clients that experience long-term oncology care, maybe they've got metastatic breast cancer and they're under treatment for many years, music therapy can be a great adjunct. And the relationship that you build with your music therapist can be an important part of just navigating that, and not necessarily the cure, but the healing that takes place, coming to terms with what is happening and moving through all of those treatment options and through palliative care. Music therapists work a lot with our families on legacy projects. So if a client moves through palliative care and then enters hospice care, we often will work with them to create projects that they can leave with their families. So that might be a recording, it could be a video, it could be a playlist, a list of songs that are meaningful to that family. So counseling those families through the creation of that, and then making sure that that is produced and packaged and provided to the family, is a really powerful part of the work that we do. So keeping in mind that it's for all ages and stages, not just during chemo infusion, not just for the client, it's for the client, their family member, and all of their care partners. So music therapy can take place in a lot of places. There are music therapists that work as part of the oncology care programs in our larger hospital systems. There are music therapists that have their own clinics and counseling centers throughout our communities. And there are music therapists that travel and come to the client. So if you decide that music therapy is something you'd like to pursue for yourself or your family, there are lots of different models for how to access that. So you can schedule that appointment to happen while you're at the infusion center or at the Cancer Resource Center. You can schedule an appointment where you would go to the counseling center, or an appointment where the music therapist would come to you. At the end of the video, we'll put up a couple of websites that will be really important for you to know how to find us. So, as I said, I'm practicing throughout Louisville Metro, and I'm available to answer questions, and I do provide individual and group and support group music therapy services. So if you have questions about the work that I do, happy to answer those anytime. And then a great resource for music therapy, just information about music therapy and how to find a music therapist in your area, is from the American Music Therapy Association. And their website is musictherapy.org. But if you have questions, my contact information will be at the end of the video, and I welcome your questions, your comments, and would be happy to help you in any way that I can. I hope that you and your family and your care partners are feeling well as you navigate your oncology journey, and I hope that we will be able to provide support to you through the music therapy community. Thank you.